All right, welcome back to Hype. Today we are answering questions from the public. There has been a very exciting few developments this week that I look forward to sharing with you. But first, before we get into that, we're going to address some public questions. So, rapid fire: who should get vaccinated first? Well, that is a terrific question, and if you saw the news and been online on Instagram, Facebook, some of that, you may have actually been a part of what people are now doing, and they're fighting over based off states who they believe should get vaccinated first. And one of the articles even stated, and I think this was even a tweet or something along that, just got like reading over it, but they're discussing that it's not an essential worker maybe in Texas, maybe completely considered a different, essential worker than maybe in Arizona. So you just need to, people are fighting right now. And it's interesting to see that now that we're shifting this, because the last part of the fight I think that we've had as a nation was the mask shaming. And we kind of saw that and knew that was coming. And we didn't really realize that the United States was going to break it down individually by states, and the states being in charge of the actual vaccination distribution. So you're leaving this up to a bunch of legislators and policymakers within the state, and everybody has different agreements and ideas on who should get it. However, the public isn't necessarily as happy, nor do they agree with it. These are decisions that have largely been made without the guidance of healthcare influencers and healthcare organizations, especially seeing as about around over 90% of most medical decisions or healthcare decisions nationwide are based from a single corporate location, where they're all based in Tennessee. So it's funny that we're making all these single decisions and group decisions that no one agrees on, but we're also not including the healthcare community on it. And I think that's really we need to address that, because the two people that are not focused right now on this are not involved in the conversation, and that's you, the public, and that's the healthcare community. That same hospital has an organization in another state. So we need to align the healthcare groups that already have national presence, can get your voice on this, and let's get it out there. So is it available? Yes, it's about to be available. Does everyone need it? No. And everyone's disagreeing. So I ask that, we need to quit fighting. We're not turning this against each other. We don't need another, mass shaming, there's all of these different fights that we could be having. However, at the end of the day, it's really up to the public voice. And, I love that we're getting involved in this. I love that we're sending, tweets and all of this. But, guys, that doesn't make influence. That doesn't change decisions. So what I'd like to do is, though, from a population health standpoint, I'd like for you guys to come to us. Tell us what you guys want as the public, and then let us help, with that, because, we're in communications with these groups, and we're trying to help. We have the health care networks, we have you guys, we have a lot of the manufacturers. This is not as hard of a decision as what we're making it out to be. And that's why I want to go ahead and get into the next prompt here, to discuss the vaccination changes this week. So we have the first authorized vaccination coming out. The first shipment is supposed to be this upcoming Monday. And that is where now the rubber meets the road. People have to make decisions. So this is exciting, right? The vaccination itself, they found that you're going to need to get about two doses of it, and they're in Medicare. One is not going to charge for it. I mean, they are, but they're not going to require a copay. It is going to be reimbursed. They aren't going to require cost sharing, and it is over 97% effective, they say, through previous studies. So this would be the first time that we had a vaccination brought to market in actual record time, coming out this upcoming Monday. Am I promoting this, that everybody should get one? I don't think that everybody should get vaccinated. And no, I don't think that should be a thing yet. What I think is very interesting, and I do highly, highly recommend vaccinations, but appropriately and targeted and controlled. And that's what the government is having a hard time saying right now is, look, we need a group that's going to do this targeted and controlled. And that's Ron Klain, the chief of staff's entire operations, trying to figure out how are we going to be able to do this, and for a group that may not be be eligible for vaccination, but maybe at high risk versus those who are eligible versus not high risk. So data is the only thing that we have to do this. And we've actually found that there's been a lot of data issues that we've been having recently. Prior to COVID, less than 5% of healthcare data had ever even been harnessed, accessed, or utilized. Yet 70% of all medical decisions were based off data. That's the whole reason we started the health exchange market, my company, because there was that gap there. So I want everyone to be aware that this is coming, the vaccination. No, it's not required. Yes, it may be mandatory for certain jobs, but the Department of Labor is not requiring it. And I guess the last piece of this that is important to realize just for the vaccination as this is coming out is that there are, again, different states and they all have different phases on how they've come in. Not all people are going to be, or not all people are going to necessarily benefit from this vaccination. Some may benefit from different vaccinations. And there may be the case, and we don't know yet, where you may need the vaccination 8 times within the year other than just the 2. So there's a lot out. I want people to think of this more of like the flu vaccine as opposed to something else. Ebola, for example, mortality rate for that is about 50% of the people who get it, whereas the flu is about 1%. So this one is not quite as, it does mostly affect older people, younger people, not quite as much. However, the long-term effects are drastic. So, I will keep you guys updated as we know more. But we do have good news, and congratulations to the healthcare community and the researchers for getting something done in record time. Very proud of you guys, and we look forward to hopefully promoting this and educating the public on other ones that are coming out and who's eligible. If you are interested in perhaps stating your advice on whom you believe should be vaccinated, we'd love to hear from you. With the one I would like to leave just with one interesting thought, and that is most people right now have reported that they do not want to get vaccinated. They're refusing to. They're saying, I'm not going to be a part of it. However, everybody's got their own say on who needs to get vaccinated. So I just want to put something into people's minds here and say, it's not who is fighting to get vaccinated. It almost seems as who's fighting not to get vaccinated. And I think that we do need to put that into consideration as we move forward. So with that being said, thank you again for joining Hype. We will keep you posted. And congratulations. Stay strong and stay tuned. Thank you.